Next is the differences between indirect and direct hernia. Indirect or oblique. The right one is the direct. Okay. The indirect or oblique, in which there is partial or complete patency of processus vaginalis and invagination of the peritoneum. Partial or complete patency of processus vaginalis and invagination of the peritoneum. It may descend into scrotum. It may descend into scrotum. The coverings are extraperitoneal tissue, internal spermatic fascia, cremasteric fascia, external spermatic fascia, and finally the skin. See, there is external and internal spermatic fascia. In between comes the cremasteric fascia. So these are the coverings of the uh, indirect or oblique hernia. The next one is the direct. Occurs through the posterior wall of inguinal canal. The direct hernia occurs through the posterior wall of inguinal canal. The first one occurs like this, like that the partial or complete patency of processus vaginalis and invagination of the peritoneum, whereas the direct inguinal hernia occurs through the posterior wall of inguinal canal. It occurs through Hasselbalch's triangle. Very important point. Hasselbalch's triangle. It is a key point. See, here is the Hasselbalch triangle. This Hasselbalch triangle is bounded by inferior epigastric artery, lateral border of rectus abdominis, and inguinal ligament. 3 points. See, here is the 3 points: inferior epigastric artery, lateral border of rectus abdominis, and inguinal ligament. The area divided into medial and lateral parts by passage of obliterated umbilical artery. By the passage of obliterated umbilical artery, the area is divided into medial and lateral parts. See, coverings of lateral direct inguinal hernia and the coverings of medial direct inguinal hernia. Coverings of lateral direct inguinal hernia and coverings of medial direct inguinal hernia. What are the coverings of lateral direct inguinal hernia? Extraperitoneal fascia transversalis, cremasteric fascia, external spermatic fascia, and finally the skin. Then on right side, coverings of medial direct inguinal hernia, there is extraperitoneal fascia transversalis, conjoint tendon, external spermatic fascia, and skin. See, in place of cremasteric fascia, there is conjoint tendon in medial direct inguinal hernia. See, the direct inguinal hernia. Here is the direct inguinal hernia. Here is the direct inguinal hernia. Medial, lateral, medial, lateral. Okay.